Good afternoon. I'm George Latimer, Westchester County Executive. This is our 2 o'clock update from Westchester County on the coronavirus issue. We're here at the Support Services Building of the Westchester County Department of Emergency Services. This is the center of the action for the accumulation and the distribution of various products that are necessary for our communities and our various first responders in order to fight the coronavirus on the front lines. It's in this building that we use to collect and then redistribute PPEs, personal protective equipment, hand sanitizer, other types of necessary products that are used by hospitals, by fire departments, by emergency services groups within the various towns and cities and villages of Westchester County. We're here today not only to give you an interesting visual as one part of what the county government is responsible for doing in fighting the coronavirus, but also as a means of thanking Con Edison, because it is Con Edison that has been very gracious in shifting over their manufacturing operations to be able to develop 40,000 face shields for Westchester County healthcare workers. And to tell us a little bit about what Con Edison has done to do this very generous action, we have with us Shakira Wilson, who's Vice President for the Bronx Westchester Electrical Operations for Con Edison. She's joined also by Jane Solnick from Con Edison, a good friend. We've worked through a lot of issues. But Shakira, please come over. We'll socially distance and have you tell us a little bit about what Con Edison has done here, for which we're very grateful. Please.
So thank you, Mr. County Executive Latimer. On behalf of the entire workforce at Con Edison, we are so excited and proud to donate today 40,000 protective face shields to the healthcare workers of Westchester County. We are all working together to get everyone through this pandemic safely, and we can think none other than to support the healthcare workers who are on the front lines, risking their lives to help others. So what we did is, in one of our warehouses, one of our own warehouses, we've had the very talented women and men of the Utility Workers of America, Local 1-2, our managers and engineers, create and design these protective face shields that you see over here. And today we're going to present you with 6,000 of those protective face shields. And at the end of the month, we will deliver the remaining face shields. And just with everything going on in these difficult and trying times, people are really trying to contribute and think of ways to help others. So I first want to personally thank our union workforce and all the employees at Con Edison for helping and their dedication and commitment to this wonderful cause. And also to you, Mr. County Executive Latimer, for allowing us to be able to contribute to this and help others during these very difficult and trying times. So thank you for the opportunity.
This is really a very gracious gift of energy as well as product on behalf of Con Edison. Please thank Tim Cawley, who's the president of the organization, for this. I feel like I'm going to do a little product placement here, but the bottom line is that perhaps this is better done by Vanna White on Wheel of Fortune. But these face shields, I will just show it this way. This is fine. These face shields will cover over the hard hats, I gather, and protect the workers from anything that might normally impact them. And the kind of face mask that you're wearing that normally you see in a surgical capacity, this gives greater protection to the medical worker, to the health worker. And that's really a tremendous accomplishment. So thank you again to the men and women of Con Edison through the local union, Local 1-2, for doing this. And 6,000 by the end of the month is going to be a great asset to our healthcare workers, and overall 40,000 is really a tremendous contribution, for which we thank you. I also want to extend gratitude to Commissioner John Cullen and his team, many members who are here with us today. They have worked an unbelievable number of hours trying to be responsive to these things. You will hear all the time about shortages in PPE. That's the acronym that most of us never heard of about a month and a half ago. And we get calls all the time from one organization or another, some elected officials that say, we're almost out of this, we're almost out of that. And it's very difficult to maintain the supply, because now you need face masks of the proper nature and gowns, gloves in an innumerable quantity. Because every time you deal with a patient who has COVID or might have COVID, whether you're an EMS person responding in a private home to an issue, you're a police officer that has to interdict somebody in the rounds of your work, if you're working behind the counter in some public capacity, these shields will protect you from getting those diseases, and yet you have to throw them away or reuse them or wash them where you can before you have another interaction. Otherwise, you'll be spreading the disease that way. So, John and your team, thank you very much for all the work you've done. We deeply appreciate it. These, by the way, are the unsung heroes of government. Many times, those of us in elective office get more credit than we deserve. And more often than not, the credit we're taking is really the credit that belongs to the people that do this work here. And they do it without much fanfare. There are no parades in their honor. But we would not be fighting this contagion with this degree of effort without the people here who are working for the Emergency Services Department. Those are in the County Health Department, the people in a variety of other departments that are out there working hard. And I would also be remiss if I didn't thank members of my team, particularly Susan Spear, who has been on assignment over here. We haven't seen her in any other context. This is her permanent report. She's done a terrific job of liaison between our office and the county executive's office and emergency services. So Susan, personally, thank you very much for your effort and time. Our report today on the status of the virus does not come with it statistics, as we usually like to share each day about where we are in the process of dealing with this healthcare concern. We were waiting for an update in the New York State Health Department tracker, and anyone that wants to can see some of the same basic numbers that we use in our reports by going on to the New York State Health Department website. It's COVID-19 tracker. When you search within the website, and you will see a series of statistics that give you statewide numbers, and they break it down by counties. They'll give you information about how many people have tested positive, how many people have tested overall, what percentage that is. It will also give you fatality information, and will break down as well information that comes from nursing homes as a specific subset of those who have suffered fatality. The numbers that we try to report each day, and again, I don't have the updated numbers today, we take the total number of positives, which is a number that constantly rises, but we take from that the number of people who 2 weeks ago today were identified as positive. So 2 weeks ago today, on the 3rd of April, there were 12,351 cases. If today's number is somewhere in the 22,000 range, then that would show us the number of active cases, total number of cases, less the number of people that have gone through the 2-week period of time. I probably state this every single day. It's probably monotonous, but I say that so that you understand that what we're tracking as the most important part of this contagion is the number of active cases, people who have not yet cleared that 2-week barrier. As I display how to cough on camera, the number of active cases also have to be judged against the number of people hospitalized. Our number yesterday for hospitalizations was 1,129. Our number today is functionally the same. I think it's 1,119 or something in that vicinity. That is a flattening out of the number of people hospitalized. It may not be the exact same people. Some people may have left the hospital over the last 24 hours. Some new people may have been hospitalized over the last 24 hours. But that net number has been flat now for 10 days to 2 weeks. That is a good sign, along with the number of active cases. That does not mean that we are through the contagion. That means that whatever you saw on other televised reports, that there would be a bell curve peak, that you would start out with so many cases, it would rise rapidly, you see the peak at the top, and then it would start to come down. That the argument was we want to flatten the curve. What does that mean? We don't want the peak to be so high. We want the peak to be a lower peak and to level off as a plateau before it comes down. And that's because the delta between a flattened out curve or peak curve is how much hospital services can you provide to the people who are sick if the peak is here or if it's flattened out at this point. If in fact we are flattened out at this point, then the 3,000 plus hospital rooms that we have, the amount of PPEs that are here in this building and out there in use will be sufficient to handle the people who are ill. Some number of people upon becoming ill will be healthy and be able to go home at some point in time. But we don't have an antiviral drug to be able to administer a person who's sick. Science has not yet discovered that. If you have that kind of a drug and then you can apply it, you assume that most of the people who get sick will then be able to recover. Right now, since you don't have that, you need to be able to give them basic care, hydrate them, try to moderate the fever so that that doesn't take them. Where necessary, go onto a ventilator. Some folks, when they get on a ventilator for some length of time, are generally not going to survive this, but some have. And we have stories, people that we know that have gone through this process and come back and now are healthy enough to be able to begin to resume their life. And that's what we hope for the most number of people. As of yesterday, we had 668 deaths in Westchester County. We don't have today's number. However, the number yesterday was of 28 additional deaths from the day before on Wednesday. 28 deaths are a lot of people to die in a single day. However, that was the lowest number of deaths that we've had over the last 2 weeks. And if that is a trend, and you don't know that it is or isn't until you see multiple days. It's like rooting for a baseball team. If they win 2 games in a row, you're ready to put them in the World Series, but you have to watch how they play over the long haul. This is an everyday reality for us here. If in fact that death rate continues to lower at that basis, we will have lost a certain number of people. That number will grow. But the rate of death will recede. And if that happens, then that is the strongest example of the curve being flattened. And at some point in time that the curve goes down. We want to restart the economy. This is not a debate over should we or shouldn't we. This is a question of when do we? And I think the general sense that many of us have is that we want to reopen the economy as soon as we can, responsibly. Because if we reopen the society, if we say it's fine to go back to restaurants, live the life as you had it before, and if we haven't really put this contagion on the downslope or near to a zero area, it will flare back again. And the flaring back means additional people getting infected and additional people potentially dying. Now, back there in the storehouse, we have PPEs for people to wear gloves and masks, and we have hand sanitizer. We also have body bags back there. And a body bag is used when a person has died. And right now, the system of funeral homes and cemeteries, places where people will be cremated, are not sufficient to be able to handle all these deaths. No one plans to have 600 deaths in a month and a half. That is what we're trying to stop. That is what we're trying to reduce. That is why, if you don't reopen the society this weekend, as much as you might want to, this is why you don't reopen the society. I'm a big baseball fan. All my friends know that. I would like nothing more than to be watching April baseball right now. But what is the responsible situation? I want the PPEs back there to be used productively. I want those body bags to stay back there in a box. I don't want them ever to have to be taken out. And it's not just what I want. I think it's what we all want as a society. Now, we know that this disease is affecting people primarily of advanced age. 70 and older represents 2/3 of all the deaths in Westchester County. 60 and older, now you've got me included in the number, 60 and older represents 84% of the deaths. And we know that if the contagion spreads, it may not affect younger people, but it will affect a certain cohort of people. So that is why we want to try very hard to see that the curve flattens, that it goes down. If we can have the right amount of hospital beds, we're in a good place now. We have backup beds waiting for us at the county center if that's necessary, but we want to try to flatten the curve. That's why these people are working overtime. They're working overtime because they know that everything they do is one step closer to saving somebody's life. That's what emergency services does under normal circumstances. Our commissioner was trained as a firefighter, trained to go into a burning building and save somebody's life if that was called upon him to do. We have other members of this team that are trained to resuscitate if a person has a medical urgency, which may cause them life or death. On this campus, we are very close to Westchester Medical Center, which is no longer part of Westchester County government, but they are still a tertiary care institute here. Every day in every one of those rooms, there's a battle for somebody's life. And we want to win those battles. We want those people to be healthy and walk out of that hospital room and go back home and have more of their life to enjoy. That's what this whole thing is about. And hopefully that's what we're doing today. That's what the Con Edison donation represents. It represents a way for people in the healthcare field to work and help sick people and not get sick themselves and not potentially suffer the same fate that they're trying to save for someone who they're working on. And that's why this is such a tremendous contribution that they've made. I just want to mention a few other points very factually and specifically. We have an advisory that has gone out on the question of plasma treatments. And that is something that there's been a buzz about in the community. Certainly, if you have a relative who is suffering from COVID, serious situation, everybody is anxious to know whether or not plasma treatments can be given as an effort to try to save your loved one's life. This instruction sheet, I won't go through all of the details, it is targeted for medical professionals. It indicates that physicians and healthcare facilities who are interested in treating patients with convalescent plasma should visit the New York Blood Center website. The product is ordered just as you would any other blood product. The Infectious Disease Society of America has issued recommendations for how these things could be used, and there's a profile sheet that medical professionals can access, and we provide that for them. And then any more information about the trials that have been used for COVID-19 patients are also made available on the National Institute of Health Clinical Trials website. All of this information is provided through our Department of Health. Dr. Charlita Amler, who's our Commissioner of Health, she has done a fabulous job working round the clock, and she's put this public health announcement out. And this is basically to say for individuals to consult with your doctors. If you think that the loved one that you have that's suffering from COVID-19, in theory would benefit from plasma treatment, and to recycle through that fashion as well. Also, in the information we want to share, we have concerns that many of our first responders are dealing with COVID diagnosis themselves, and that during the period of time that they've been identified as a positive, they're, like anyone else would have to be, they're asked to be isolated and therefore not at work. And when you have policemen and police officers and firefighters that are down off the job, that reduces the amount of response that you have when you reduce the force. It is more concerning for us in our smaller municipalities. In villages and towns of a certain size, they have very small police forces. They may have a small professional fire department force, a small volunteer fire department force, and it reduces their ability to respond. So we wanted to know that we as a county government have reached out through our Department of Public Services. Tom Gleason is our Commissioner Sheriff. He's in essence the head of our public safety, county police, if you will, department, and he has put a note out to all of the various municipal governments so that any of their local law enforcement individuals, if they're having trouble putting together enough staff to manage the ongoing police responsibilities of their departments, they should call the Commissioner of the County Police, and we will work with them and try to offer assistance wherever that's possible. That's a case-by-case basis, but it's another example of levels of government working together. And when people look at government, many times you hear about, well, the feds are fighting with the state, is fighting with the county, the locals. This is cooperation. And again, it's cooperation in order for us to do what our jobs are, which is to try to save lives. I also want to mention that we've known for now about 4 weeks that we've had a drive-in testing facility at Glen Island. The county owns Glen Island Park. It's a recreational park. Under other circumstances, people would be walking around it now in the off-season, getting ready for the beach season to start, the picnic season. We've turned Glen Island Park over now for the better part of a month to the State Health Department to serve as a drive-in testing location. There's also drive-in testing for COVID here at the Westchester Medical Center, not far from where I'm standing. And now the State Department of Health has established some walk-up testing facilities, and they're targeted inside some of our inner city locations. The Neighborhood Health Center in Mount Vernon, which is located on East 4th Street, right by Leicester Towers, is open today from 12 to 5 as a walk-up site for testing. But you do have to call in advance to get an appointment. Call the Mount Vernon Neighborhood Health Center, and generally your doctor is the one that will advise you to get a test. But we want to make sure we're testing in a location that is convenient for people who may not be able to drive over to Glen Island or to somehow make their way up to the Westchester Medical Center. And at St. John's Riverside's Park Care Pavilion, separate part of the Riverside, St. John Riverside system, they will be opening up a walk-up testing center next week. So look for that. That's in Yonkers. And there'll be some other ones. We're looking at other places with the State Department of Health's obviously approval and direction in Yonkers, in Peekskill, and some other places where we think we can reach more people. It is true that we have tested more people in Westchester County per capita than any other part of the nation, as we understand. We've tested over 65,000 people in a county of 1 million people, so that represents a significant percentage of our total population. But there's still a much larger group of people that haven't been tested. If you haven't been tested and you have the disease, you're communicable. And you may not know that you're tested, you may not feel any symptoms of it, but you're giving that disease to the people that you meet. When you touch a surface, the next person touches the surface, we have to make sure we sanitize that, that you could be giving somebody the disease unknowingly. So that's why testing is so important. And we have to make testing more available and more accessible. I worry about the county of Westchester. We want to make it more accessible, even though we're the county that has the highest amount of per capita testing. All of our statistics up until today have shown that out of every 3 people that are tested for COVID in this county, 1 is tested positive, 2 have tested negative. And that's a good sign. The flattening of the curve and the number of negatives that we have out of the test helps us believe that while the contagion has spread, it has not spread in a universal way. But if we don't know, If we don't test, we don't know. And so these sites additionally are positives in those directions. I'm going to stop. I try to keep these things limited to substantive updates that we have, and then I'll take some questions from the press. And we will not have a briefing on Saturday or Sunday. We'll be back on Monday for an additional briefing, but the work that these folks are going to be doing here at this center will not stop today. It'll go all through the weekend at various times of the day and night. The work of the health department will not stop during work hours. It will continue through. The mental health department of the county will continue to operate their hotline at 995-1900, and we will continue to work tirelessly until we get through the contagion. And then we will deal with the economic issues that follow that, not just the county budget, but the problems that people are facing in unemployment, the small businesses that have been closed. We do not view our job as being completed just going through the healthcare issue. We also go through the economic revitalization of this county. We are not just in for a penny, we're in for a pound. With that, I'm going to go to any questions. Catherine Chaffee.
Okay, first question comes from John Gordon at 12. He says, last night, Mount Vernon Mayor Sean Patterson Howard told News 12 on air that she had to use her own money to buy for the city. Do you have a reaction to this? And has the county had to go to any similar lengths to support PPE of its own?
Well, I don't know the specifics of what's happened in Mount Vernon. I do know that there are some governmental structural issues in Mount Vernon that don't exist in other communities, because Mount Vernon has not only a mayor separate from the council, but they also have an elected controller. They're the only community that has that. So sometimes decisions in Mount Vernon have to clear all three decision makers. Unlike the vast majority of our communities, the council directs the village or the town manager, the city manager. So it's a different governmental structure. Certainly, we're trying to provide for Mount Vernon professionals as much of these PPEs as is possible. John and Susan on our behalf, and John on behalf of his department people, will indicate that we have given PPEs, numerous requests to the fire department, to the various structures in Mount Vernon. One of the problems that we face, though, is there's constantly a use of these products so quickly that the demand never ends. And we're not in a position to be able to supply any institution with a month's worth of these items. Much of it is available at the moment that it's available. It goes out as soon as it's available, and it takes care of us for a very short period of time. We did have a deficit in the number of gowns. There was an alternative product that was used during that deficit period. We're relying on what we get from the state of New York and whatever other creative things that John does that I'm not supposed to know anything about. But there are ways to try to be able to obtain this material. But as soon as we have it, we give it out, and we try to satisfy every community's needs. So for Jonathan's purpose, if he wants to follow up, we'll chat offline. We'll check out what the specifics are in Mount Vernon. We certainly want to help Mayor Patterson Howard and help her solve the problems of that city, because it has had a real spike in the number of cases. It is the most densely populated part of the county. It has a large number of people who are poor, and we don't want the contagion to spread like wildfire in a setting like that. So we're certainly going to try to be as helpful as we can.
The next question comes from Wilbur. He says, given that the money for the Small Business Association loans have been exhausted, will the county continue training and helping people complete applications in anticipation of the federal government providing more money?
Well, it's very frustrating to us from the county government that we had put together, under Bridget Gibbons' leadership, a cadre of volunteers, went through a training process with them, and now we're on the verge of helping small businesses make the applications. And anytime you apply for government money, it's complicated. It's never a simple process. And we knew that many of the small business folks would, find this time-consuming and maybe confusing. And so we had that cadre of people together, but we have frozen our efforts until we determine or not going to see additional money allocated for the program. It doesn't make much sense to put the applications together and then find that. Obviously, we've expressed to our federal United States senators, who have been wonderful partners to us in all of this, are concerned that the money has dried up, and before many Westchester entities have been able to get their access to it. But it doesn't make sense for us to submit applications that just queue up without resources there. But Bridget and her team are ready to restart the engine as soon as we know that there's some additional money. And hopefully that will be forthcoming. The frustration that the average taxpayer has, the average resident has, the small business, the large business as well, but the small business particularly, this is real. And we're not blind to that. We're not blind to that. we understand that this is a serious issue. I spent 20 years of my life in the private sector, and when the private sector stops functioning, so does the society as a whole. So government, can't ignore the pain that small businesses are facing. And this program was constructed to help people get through this, which tells you that the need is so great nationwide and that the federal government's role is so critical. There are things that we can do at the local level, but there are things that only the federal government can do. And the federal government, as we are trying to perform our role, the federal government has to perform their role. And if they have to go back into session and allocate money, that's what they have to do. Otherwise, the collapse of the United States economy is good for no one. And that's where we're heading if we don't have support for our small businesses and our individual taxpayers.
Next question comes from Mark Umbriello. Is there a tally of cases in county staff, and are you in favor of starting to share those?
I'm sorry, I missed the core part of it.
The tally of COVID cases among the staff in the
On
county.
county workers? Yeah, I'm not sure. I don't know that we have that number. We certainly will try to find that number if we do. I'm concerned over anybody having it. We know of a couple of county workers in various departments that have it. And of course, the minute they identify that they test positive, they go into the 14-day isolation. So we're certainly not having anybody who's tested positive and has not met the criteria for isolation release out working in the public. So that isn't an issue. To know what the total number of employees are that have it, we can certainly find out that number. We'll release it as a matter of public knowledge. We won't release individual names, though. They're covered under the HIPAA law. And HIPAA, which is an acronym for a federal law, requires all entities to retain confidentiality when a person's health is at stake. So we won't release names of individuals, but we'll see if we can get an aggregate number and be able to share that. That might take us, beyond the weekend to do that, because we have to stop what we're doing and go check department by department how many people have tested positive. But we can do that.
And the next question is also from Mark. If the county legislature passes their tax penalty plan, do you plan on signing it or will you do it?
Well, I think I've been very clear that the standard that I want to see happen is a complete release of any late fee for those who have property taxes to pay. April 30th is the functional deadline for people to pay their county property taxes. It's my sense that should be a July 15th deadline for those people who have economic hardship because of coronavirus. That's not everybody. And certainly those who pay through mortgage escrow accounts, that money has already been accumulated, and those should pay on time regardless of the status of the individual. That becomes a matter between the individual and their mortgage company. But, and I would also say people that don't qualify for the STAR program, which would be those with much higher income, they might have suffered some financial loss, but it's not crippling enough for them not to pay the taxes. But for the person in the middle, which is the vast majority of us, the middle class taxpayer, I certainly support not just a lower fee, but I support no late fee and going to July 15th. Now, the legislature may be acting this afternoon. When they act, we'll look at the bill, they'll send it to us, we'll scrutinize it, but we're going to look at what executive authority we have, either directly or through the state, that would allow us to accomplish what we think the mission should be. And what we think is there should be no late fee for an individual paying their property taxes between April 30th and July 15th. Now that relates to the county government. I can't speak for other jurisdictions. A town or city may decide to do something with their local taxes. A school district has their local taxes, but from a county standpoint, we think that is the right strategy, and we're going to pursue what executive authority we may have along those lines. If we can find an appropriate way to accomplish that, we'll do it in concert with towns and cities. We're not going to do it to oppress them. We'll work with them in implementing it. We'll soften the blow and what it takes for them to implement it so we can do it. Because the mission isn't to have a political arguing point. The mission is to release the late fee so that the individual doesn't have to pay it. And if they pay it at any point in time after July 15th, then they're subject to the normal fees. But the concern is that during this interim period of time of 2.5 months, this is when the federal benefits are supposed to kick in. This is when those payments, those stimulus payments, the individual should come in. This is the period of time in which the state is trying to operate with the unemployment insurance payment. But the individual who's lost their job may not have money yet from unemployment to compensate them. They may not yet have a check from the federal government. Why should we apply a late fee It's not a willful lateness. It's a lack of ability to pay because of the coronavirus. That's an unusual set of circumstances. And they may fall under executive authority that's possessed. But, I think the legislature is operating on their level. I have no gripe with them. If I disagree, we disagree. That doesn't mean we're not looking for a different strategy, which we think, if we can execute it, is what we're going to do. Okay, very good. Well, thank you for the time. We appreciate it. We want to thank again our hosts here from the Department of Emergency Services, who are working for us every day, whether we're here or not. And we thank you for watching. We'll see you again on Monday. We'll have a Facebook Live interview at 11 o'clock. We'll give you an update at 2 o'clock. You can go online, as I suggested, to the New York State Department of Health COVID-19 tracker, and you'll be able to see some of the statistics that I would otherwise give. And for our friends in the press, as soon as we have a breakdown of numbers by municipality, we will send that out, share that with you. And obviously, you can update the general numbers from the tracker as everyone else's. Thank you very much. I'm George Latimer. Have a good day, a good weekend, and stay safe.